This work has been started 2 years ago in our institution. Is take care for one specific lesion located on chromosome 16, which is the PALB2 gene. This gene has been associated in a Nordic breast cancer predisposition. So it's a gene that makes the DNA repair, and so it means that when we get a breaks, this gene cooperates to repair this damage. This is a very important gene because it could be involved in repair of cancer chemotherapy, and progression of the disease is associated with additional genetic lesion that can be acquired by leukemic stem cells. We find that there is a great influence of this gene and predominance of this gene also in leukemia. This is the first time that the gene has been associated with leukemia, and the more important and relevant point is that it can be associated with a better treatment. In fact, we find that PALB2 is related to BRCA1 and BRCA2 deficiency, and now we know that there are opportunities that has been presented in this meeting. There is opportunity to treat the patient with BRCA1 and BRCA2 selective drugs, like the PARP inhibition. That will be very important for our patient in the future, and we are starting to get some clinical trial demonstrating that it could be important for this patient to be treated with PARP inhibitor. Thanks.